Hi mga arthritis warriors, I'm Dr. Jonathan Flordelis and welcome to our knee injury live. Today we're going to be talking about ACL injuries, and let me know if you're hearing me loud and clear. We're broadcasting live at the Cebu Orthopedic Institute, and if you know someone who's injured their knee or tore their ACL, click on the comment below, share this with your friends who might find value from this live. And we have compiled questions. So let me know if you can hear me loud and clear, where you are from, and if you know someone na injure ang tuhod sa sports. If you know someone who wants to get back in the game, we are definitely helping those patients na ganahan mabalik sa ilang dula. We have a guide. The guide is called Your Guide to Modern ACL Reconstruction, and it's called Getting Back in the Game. So, Getting Back in the Game is a free guide I'm giving away. Let me know if you want the guide. It's free with every consultation here at the clinic. And without further ado, we're going to go into the meat of the matter. Questions from the ACL community na Cebu. We do have an ACL Reconstruction Community Cebu Facebook group, and we're answering questions from different members of the ACL Reconstruction Community Cebu Facebook group. So if you know someone with injury sa tuhod who wants to get back into sport, you can get the free guide here at the clinic or download it at our Facebook groups. Question number 1 is the question that unlocks everything about ACL injuries. Doc, can I get back to my sport? So a lot of patients who have injured their knee have this dread na, oh, Doc, I won't be able to play na, I won't be able to enjoy life, do my sports. They have the feeling that something is wrong with their knee. If you know that your knee is unstable, like this here is an unstable knee, you will feel that there is a movement that they can feel, no? So that feeling is instability. When you have an unstable knee, confidence goes down every time you play, especially when you pivot in basketball, volleyball, or soccer or football, you feel that instability. So, can I get back into sports? Most of the patients can get back into sports, and yes, even better than before. But each patient is different. So always consult your doctor and get the best advice. Remember, not everyone needs surgery, but we need to check your knee in the clinic for instability. This instability is very clear in the clinic when we examine your knee. It's not all about getting MRIs, and do not lose hope. Yes, it is possible to get back in the game. So I hope that answers your question. No one is asking, but everyone wants to know this. So yes, you can get back into sports. So this is one question, and I want you to stay until the last question, because I'm going to reveal the number one thing that can predict a possible ACL tear. Try balancing for 10 to 15 seconds. If you feel an imbalance standing on one leg, that may mean you are at risk for an ACL injury. So, what's the next question? Doc, how can I walk normally, but I cannot play basketball? Remember, the ACL is the ligament inside your knee that controls stability. This is the reason why you can't play basketball, because pivoting movements like twisting give a unstable knee. So twisting or pivot movements in basketball, cutting movements, those are all movements that affect the ACL. But walking is a function of the quadriceps. This muscle here is the quads. That is why you can walk normally. And a lot of patients with ACL injuries later, after 1 week, may not have pain anymore. Don't have pain, but they do have that instability na feeling. So that is the test. Try to stand with one leg balancing for 10-15 seconds. If you feel an imbalance, it may predict the possibility that you may get injured if your balance is bad. So, question number 2, Doc, why did my knee swell after the injury, and it only swelled for 2 hours, but my ankle sprain took weeks? So not every patient is the same. Some get more swelling than others, but definitely you have bleeding into the space. That is what we call hemarthrosis. When the ACL tears, it bleeds, and it bleeds into the joint space. It can happen after a few hours. Some can have swelling for a week. Others will have less. Definitely, the best test is getting that physical examination in the clinic. Second best test is your MRI scan. So, when you have massive swelling, there are patients who can get it drained if it's really causing you pain. Some will let it subside. Again, every patient is different, so please consult a doctor before you try to do anything. Next question. Remember, if you have questions, comment in the chat below. Like, follow, and share this with your friends who've had a knee injury. We're inviting you guys, if you know someone with knee injury, ACL tear, to join the ACL Reconstruction Community Cebu Facebook group. You can download our free guide, Getting Back in the Game. We're giving this free to patients who are getting consultations in the clinic. Question number 3. Doc, I heard a pop. Does it mean that my ACL is torn? Then a lot of patients, yes, it could be a pop. It can also be the swelling of the knee, and it is a non-contact twisting injury. So if you hear the pop, if you also have that swelling of the knee, and remember, it's a twisting non-contact injury, there may be a high chance that you have an ACL injury. So please consult a specialist near you, a doctor. But not everyone hears a pop. Usually, popping sounds are associated with ligaments. It's also a crack when you have a fractured bone, and grinding if you have arthritis. So 3 different sounds that you can learn, and that is usually the case. Question number 4. Doc, what's the difference between the ACL, that's the ACL here in the middle of the knee, and my meniscus? So the meniscus is down here, the ACL is up here. They're different, but when your ACL tears, the knee is usually twisting, and remember, it hits the meniscus back here. So both of them can be torn in one injury. The stronger the force, the more possibility of injuring your meniscus. The meniscus is also more painful when you are bending, and sometimes a lot of patients are unable to fully bend or fully straighten the knee after an ACL and meniscus injury. So again, every patient is different. Please consult a doctor so you don't need to overthink. A lot of the patients overthink, they cannot sleep, and this leads some into a depressed mood. Please don't get depressed. If you feel that there's no hope, talk to your family, talk to your friends, and please see a specialist near you. And they're definitely different because the ACL here is a ligament. It keeps the knee from twisting. The meniscus is the shock absorber that gives the shock absorption when you are landing from a jump. Now, ACL injuries alone usually take about 6 months of healing. The meniscus, depending on if it is a repair or a meniscectomy, can have different rehabs as well. Remember, every doctor is different. Every doctor will have his or her own rehab or physical therapy after an ACL injury, and rehabilitation is necessary. 100%, sometimes it is just as important as fixing the ACL. Physical therapy and rehabilitation for my patients is a must, even prior to surgery. My patients are advised to do strengthening so that even before surgery, they have more strength and recover faster. Question number 5. Can a doc, I didn't get hit by anyone. Why is it that I tore my ACL? Again, the ACL, sir, is a non-contact injury. It is usually twisting, cutting injury, or a hyperextension injury of the knee. So it's not necessary to have a contact injury to get an ACL tear. It is definitely not a weak ligament, but if there is sufficient force that you are twisting, usually from a landing, when you jump, land in an awkward position because your balance may not be good, it can cause an ACL tear. Now, we're going to question number 6. Every doctor is telling me different things, doc. I've had second and third opinions from different doctors. I'm confused whether I need surgery or not. I think this is very frustrating when you have different doctors, you have different opinions. It's a good thing to get different opinions from different doctors, but it's also confusing for some patients. So it depends whether you need, whether you have a specialist and or an orthopedic surgeon who is a general orthopod. Of course, it's also different when you are seeing a spine specialist. So my advice is, if you have a knee specialist orthopedic doctor, try to get different opinions from different knee specialists. That would be my best advice, because I understand some may want you to do a conservative management. The key is the physical examination, because if you feel that your knee is giving way like this, it's really unstable, that usually is a sign that you need surgery, because that stability does not go back after any amount of rest. The ligaments, that is the ACL, does not heal, unlike the ligaments outside the knee. These are the ligaments that heal, but the ligaments inside the knee don't usually heal. So when do I not do surgery on patients? If the ACL injury already has arthritis, if the patient is already at 50, 60 years old with arthritis, no need to get an ACL reconstruction. Making a reconstruction on arthritis will make the arthritis pain worse. So I avoid doing that. Okay, question number 7. Why do some surgeons want immediate surgery while others are telling me to wait a month? So thank you for that question. Some surgeons definitely advise urgent surgery if your knee is locked and you cannot bend the knee, if you cannot straighten it fully because you lose range of motion. In my opinion, that is when surgery becomes urgent. I have had patients who avoid surgery wanting for the swelling to go down, or maybe some of them also have issues financially that they couldn't have the surgery right away. But for me, the best time to have surgery is when everything is aligned. You have talked with your family and friends and coaches. You are mentally and physically prepared for the surgery, as well as financially. And that is the best time to have surgery. Also, look into your work or your school. Usually it's during the summer or Christmas break, semestral breaks, when we have a lot of patients who need surgery. So I hope that answers your question. Again, we're giving away the free guide. It's called Getting Back in the Game. This is a guide for ACL reconstruction. We're giving it free to patients who are consulting in the clinic. And let me know if you're interested, because we're giving it for free to download at our Facebook group, the ACL Reconstruction Community Cebu Facebook group. Moving on to our next question. Doc, the hamstring graft, is it better than the patellar tendon graft? This is a very specific question, and this is from a patient who has definitely been researching about the grafts. So a lot of patients agonize this decision. Personally, a surgeon who is more comfortable with a hamstring graft like myself, I would recommend that because I'm doing it more. Others will also use patellar tendon. If it's a revision, that can be a choice for me. Revision meaning a re-tear of the ACL. Yes, you can tear it more than once. And patellar tendons are also used more abroad because they want early return to sports, while hamstring is for less knee pain so that you can kneel down. And those are things that Asians really need. They want to pray, they want to kneel down. That's why most of the countries in Asia prefer hamstring grafts. Most of the countries abroad, like in the US, they prefer patellar tendon because they believe it's stronger and best for young male athletes. There are pros and cons for each. Again, the site of the patellar tendon, this is where you remove the patellar tendon. It's really a anterior knee pain or pain in the front of the knee is usually the complaint. That's why you cannot kneel down. For Asians, like a lot of the Filipinos here, get hamstring grafts. Hope that helps. And if shout out to Sir Jin Madera. Hi, sir. I hope you are well. Jin Madera used to be in Cebu. Now he's abroad with his family. Hi, Sir Jin. Remember to comment. If you have questions, comment below. Let me know where you are from, and we'll try to answer questions on knee injury and ACL tonight. Question number 10. Doc, online it says 6 to 9 months, but my surgeon says it's 12 months of healing. Which is true? Yes, so you've had NBA players wait 8 months or 12 months and others come back in 6 months. Every patient is different. Every surgeon also has his or her own protocol for physical therapy and rehabilitation. When you have a surgeon who wants a traditional rehabilitation, it's usually 12 months. So 1 year is usually the time they give. Others who are more aggressive with a pure ACL injury can do 6 months before going back into contact sports. There are different opinions among surgeons. There are also different opinions when you have a meniscus tear that is repaired versus a meniscectomy. So again, each surgeon is different. Always consult a doctor. Don't just trust Dr. Google online. Do your own research and talk to your doctor. They may have their own insight on why they prefer a traditional or a faster accelerated rehab program. And choose which surgeon is best for you. The data proves that 9 to 12 months isn't really arbitrary. And for patients, you can do definitely your own research, which you think is better. Question number 11 is next. What's the question number 11? Doc, I feel great now. I'm 5 months after ACL injury. Why can't I play basketball yet? Again, it depends on your doctor. Each month, I have my patients do a specific test for their knee recovery. If they pass each test, it tells me they're able to progress to the next step. At 5 months, you can probably do triathlons, but contact sports is 6 months and beyond. Again, we have to do at 5 months. At 5 months, it's sport-specific rehab. So whatever sport you want to get back into, if it's basketball, we start pivoting movement, lateral movements, jumps. Those are specific movements. We need to regain your confidence because a lot of the healing doesn't happen in the knee. It happens here. Patients also need to get confident in their own knee. So I hope that helps. You can't just play. You want to get confident and you want to, of course, consult your doctor, your orthopedic surgeon, and your rehab specialist. Question number 12. Doc, can I really play at a high level? Or is it just what doctors tell people? And this is really possible, in my opinion, as long as you stick to the protocol that your doctor has for you. It's very possible to get back at that high level. This will demand work after surgery. again, physical therapy and rehabilitation is just as important as your surgery. So you need to think about the long-term goals. It's not just surgery. It is the strengthening. It is the fascia. It is getting a lot of stretching to get rid of stiffness, to get your muscle strength back, and to get back that explosive power and confidence. It is definitely better. I've seen it. I've had patients compete at a high level and even compete in the SEA Games. So I've seen them get gold after their ACL tear. So it's very possible. So again, you can check out our patients at the ACL Reconstruction Community Cebu Facebook group. Again, we're giving away this guide to download for free or get a consult, and then we'll give this guide for free with a consultation. It's called Getting Back in the Game, and it's available for free at our ACL Reconstruction Community Facebook group. Next is good evening, Sir Lester. Good evening, Doc. I'm from Maasin, Leyte. I have a meniscus tear and have an appointment with you next week. Oh, thank you so much. I hope to see you soon, Sir Lester. Is there a question? So there's no question. I'll just answer. Again, guys, if you have a question, comment in the chat below and we'll try to answer your questions. Don't forget to message where you are from and we'll give you a shout out and try to answer your questions as well. So next question, Doc, is there a chance to re-tear the ACL? So if you get torn ACL, can you tear it again? And the answer is it's possible, because if it is a strong force, then, and it's also the amount of work for injury prevention, we need to do a lot of exercises to prevent future injuries. That is our goal. But if there is sufficient force, just like in any accident that can happen, you can still tear your ACL. Even though the new ligament can be stronger than the old ligament, it's still possible to re-tear. That is why, for me, the best is prevention, and it is a physical therapy and rehabilitation that is focused, that is sport specific. And don't hurry and play. Please consult your doctor. Personally, I have a patient. Each patient needs to commitment to not just the surgery, but to the rehab that comes afterwards. Usually, it's a minimum of 6 months for me and my patients. Our commitment is to see each other once a month for 6 months so that I can guide them through the process and get them back in their game. We have a question here from Eastern Samar, and it is good PM, Doc. Is it possible to get back to normal after ACL meniscus surgery and bend to 90 degrees? Definitely, yes, it is possible. That is actually question number one. If you started the live, that is question number one. Doc, can I get back into sports? You can get back into sports, bend your knee 90, go back to jumping, running, and contact sports if you get a good physical therapy and rehabilitation. Again, always consult your doctor because each patient may be different. Others will have more than one injury. I've had patients who have had 2 or 3 other injuries, not just the ACL and the meniscus. So remember, every patient is different, and you have to ask the question that if I have an injury in my knee, how would I treat it? Definitely, if I'm into sports, I need to get back into the game, I would have it reconstructed and I would follow a very strict protocol so that I will hopefully not get re-injured. So guys, I hope this was helpful. Please like, follow, and share this live with your friends if you know that you have an ACL injury. Shout out to Mary Beth from Cagayan de Oro. Let me know, Ma'am Mary Beth, if you have any questions that need answers about knee injury or ACL. So guys, we're almost done with this live. Last few questions. And again, from the chat group, if you have questions, please comment below and comment where you're from. We'll try to answer these questions. Doc, are female athletes more likely to get ACL tears? And the answer is yes, a female player actually has a higher chance of tearing the ACL. Usually it's hormone related. Remember, a lot of the females are primed to have a more relaxed ligaments and tendons so that it helps them in pregnancy, but it also affects the different ligaments, including the ACL. A lot of females also are more lax. So it's the anatomy, the way they stand, and the more stress in a valgus manner, valgus is like this, no? It can cause an ACL in females. So it is the anatomy of the female, the size difference, the size of the ACL of the male and female is also very different. So the males have bigger ACL compared to females. And the hormones, the female hormones like estrogen, especially during the ovulation cycle, you have a 3 times higher chance of getting an ACL. So that is very interesting. It's also important not to fix an ACL in females when they're in their period. There's higher pain. So what that means is ladies and males are different. So I hope that helps. That's all the time we have for tonight, mga katuhod. So again, join the Facebook group ACL Reconstruction Community Cebu if you are in, if you have questions about your ACL, knee injuries, and I hope to see you next time sa atong live. Keep the questions coming. Comment below where you are from, and we'll hopefully answer these questions next time. Bye-bye. Much love and respect. I'm Dr. Jonathan Flordelis. You can call me Dr. Jo if you're Cebuano hip and knee specialist. Bye-bye.